Guys, I can't see you. I'm sitting, so come a little bit there. Otherwise, I can't see you. That feel more comfortable. Thank you. I'll start with a story. I've had a client coming this week, and she works in a a restaurant, and you know, she described herself very lively and very caring for the customers, and I knew right away one area that she would need to be massaged, and that's the face. Smiling, yeah. It's always remind me, if I will ever have a politician coming for a massage, I will start with that. I would say, you can take off your mask. Yeah. So, quite controversial, yeah. A lot of massage therapists don't ever touch the face and the scalp, and I think there are a few reasons. First, some people coming with makeup and kind of hair that they don't want to mess. So you need to ask them. This is first. Second, some people don't like oil to be used on the massage, so we might need to use cream or not at all. The skin of the face has a natural oil, and all you need really is a drop of oil. So far we described two things. First, some people have makeup, some don't like to be touched with oil, some don't like to be touched at all. Yeah? It feels quite personal for them. Okay? So, however, the good thing about facial massage is that first, under the skin, it's a lot of muscles. And these muscles we use quite a lot. We use as chewing, we use as talking, and convey emotional conversation. So you have the salesperson really smiling, and actually,
fake smiles.
Yeah, cheesy grin. You're like, hello, yeah. And then at the end of the day, really, they feel almost like dissociate. When you're thinking about the psychological effect, they feel quite dissociate from themselves. So it's really essential sometimes to work on their face. Like it, great. If they don't, that's okay. I have some clients who were not crazy about it, and then after a while, they ask to save 10 minutes for the head and face, and they feel really deep relaxation. Mm-hmm. Yeah? Okay. One thing before I start, and by the way, another benefit of face and head massage, you can do it with clothes. They don't have to undress. And if they like it, it can be quite effective. So you can do it in 10-15 minutes, really nice. Imagine the scenario, someone comes quite, I don't know, feel under the weather and stress. They don't need to even undress. You can cover them with a nice blanket, close the light. You know, one thing that you need to do in your practice, once in a while, come and lie on the table that your client use. And you will be amazed. Sometimes you will see the light that interrupts you. All the small things that the client feel, you need to feel. Get massage on your table. That's important, okay? So try to do that. So let's arrange it a little bit. Can I have a blanket, please, a towel, please. And do you have? Oh, wonderful! I like this group. Look, under the knees, really good. She feels a lot better. Good. So we're doing that. Can someone turn off just this light around where we are? Thank you. And then you come in here. Yeah, thank you. So, oops, that's a bit too much, I think, for the camera. Thank you. Cool. So, the neck, the head and face. So, I'm not going to use any oil. We'll see if we need, okay? The area that I'm massaging is the forehead. I start with the forehead. Then I'm skipping the eyes, and I'm massaging the cheek area, which has the cheekbones. Can you touch the cheekbones? And then smile. Do you feel how the muscles from the mouth attached to the cheekbone. So the cheekbone is really an attachment of lots of muscles from your, so you know when you're laughing really badly, this is the place that is hurt, you know, because of this muscle attachment. Then you can massage the upper jaw, the lower jaw. Special attention will give to the masseter muscle here, and then to the temporalis muscle. Then we're going to massage the ear and the scalp. Yeah, so that would be like a complete neck massage. So we start with the forehead. Now, the forehead is quite strong, so you can. I like to use support. You see this? I'm supporting with my fingers, and then stripping the head, the forehead. You can do it this way, or you can do it this way. When I do this way, the camera can't see, but my thumbs, I keep as a support. You know, always think about support for your hands. Don't lift, because you are more unstable. So support. How's the pressure?
Good.
Yeah, good. Okay, so you can do that. I prefer that. Okay. Be careful from moving too much into the eyes, yeah? So, always a little bit back. You can do it also standing. Sorry, Misha, yes. It would be nice technique to do it with a whole... I'm using all these areas here. Okay, and then go all the way almost to the neck, yeah? Then, I'm going to show you 2 ways to massage the cheek area. You tell me which one do you think is good. This is the first one. And that's the second one. Why the second one is better? You're right.
No, the
First
face.
one's over.
Phobic.
Over eyes, yeah. Now, look what happened. Can you close your eyes? Look what happened. Do you see I create shadows over her eyes when I'm doing it? It can drive them crazy. Because they're never really sure what you're doing. Are you careful enough? So try really to avoid. I say that around the eyes, there are an area with no flying hands.
No fly zone.
No fly zone. So I'm going around, and I'm using again the support on the neck, and then I strip the muscles one direction or the other direction.
What does that feel like, Regina?
Okay.
I just can't imagine my face when it does.
Okay. So doing that, there is a nice place, a nice pressure point on the side of the nose. If people have a clogged nose or sinuses issues, really, really nice. Really freeze the whole thing. Then you move on to the side, and you move on to the temporalis muscle. Now the temporalis muscle, can you all feel it? It's on the side. You need to close your teeth quite short. So a lot of people, when they're sleeping or due to stress, they clench their jaw. So that muscle would have a lot of trigger points. So you need to, and you always find trigger point here. So you need to be careful not to overdo it. And if they don't feel symptoms sometimes, you can always cause pain, you know. But the question is really, do you need, is it really what they're looking for? So you can be gentle around here. Okay. Then massage the chin. Nice long strokes. Few times, and then you go to the ears. Really nice technique around the ears. So it's like
So you're doing the
kind
lobes, all
the ear lobes, yes.
Yeah.
That movement, really. Okay. Good. Now, the interesting thing is behind the ears are also very important muscles. So I'm really behind the ears onto the bone. Can you all try to find this area for yourself? Yeah. There are muscles on dogs and cats. You can see these muscles a lot clearer because they move their earlobe. Mm-hmm. Our earlobe is more fixed, so you can't really do much. Okay. So again, forehead going around, cheek area, yeah, jaws going to the masseter muscles, ears, behind the ears. The rest is on the scalp. You have few techniques. You can use your knuckles to brush relatively superficial. You can do that with your fingers. I prefer with fingers, a bit slower, and all the fingers massaging together. Now, do you remember the muscles there? Underneath, coming from the occipital to the frontal? Yes, I told you the name. So occipital frontalis, and it's a muscle of facial expression. So it raises our eyebrows. So yes, it's actually all the way. So what I tend to do is move the head to the side, and then I have access to all of it from the back to the front. Yeah? All of it. Give it a nice, long, strong and slow movement.
It's
quite-
is it compared to, say, working on the back? Or?
I'll come and do to each one.
Yeah.
Okay. And then bring it back. Do the other side. Yeah. Do the other side. Really, don't forget the tip of the head on the back. Really nice area. Why do I move it to the side? So I can massage the front and back together and the top of the head. It's called the vortex. It's where the head kind of meet here. Yeah, it's really nice as well. Don't miss it. Yeah, you can't see it because of the hair, but it's kind of here.
Is that right at the top of the skull?
Yes, the top. Yeah, exactly. Yeah, this is actually when you're born. That should be the first thing that comes out. Yeah. And last, it's nice to, you see, whenever I do in the head, I do slow, It's nice to finish with more like an effleurage movement throughout. And it has 3 stages. The first one, you're bringing your forehead over, your forearms over here, and you're quite nicely effleurage the face all the way until your thumbs meet up. This is the first one. The second one is that you're going towards the ears, so you're stretching the face, right, until you're coming to the middle of the ears. You can't go further down. And the third one is you're going up towards yourself. Really nice and squeeze all the way. So again, this is coming here.
So your forearms actually touching there?
Yeah, definitely. Forearms. Yeah. Be careful from squashing the eyes too much. So again, this one. So you're going a little bit down. Do you see that I'm going downward? Yeah. And then second down toward the ears, and then third one all the way. Really nice and tight. Good. And usually then you letting them to sleep. It's a very relaxing ending. You can close the light, cover them, and get them, 10 minutes if they need to fall asleep and to relax.
To fall asleep.
Sometimes, yeah. if it's not in the clinic, then I allow it. Yeah. But in the clinic, usually you don't have time. I wish to have a clinic with 2 tables, so you let them sleep and then you treat another client. That would be really, really good. But one day I'll make it. And
you can clear that in a massage and charge them for the sleep afterwards.
yeah.
Rent out the table.
Shall we go? Should we go for it? Thank you.